46, and today I'll be discussing about lower extremity functional assessment scale. There are several of these numerical scales which measure the lower extremities functional ability, and primarily it is based on the pain, mobility, and gait. So among of these are Harris hip scales, or there is Ontario McMaster University Osteoarthritic Index, and lower extremity functional scales. But today we will be discussing lower extremity functional assessment scale. So what is this? This is a questionnaire which consists of 20 questions that are used to measure the person's ability to perform everyday tasks. And this scale was developed to evaluate the clinically important and relevant changes in health in a patient. Now, moving on, we'll be discussing about the advantages of lower extremity functional assessment scales. So it is having so many advantages. Among of it measures the initial function of a patient, as well as the ongoing process, as well as the outcome in which the patient and as well as the goals, the functional goal in which you are going to keep for the patient. For example, at first we are taking the assessment of and this scale, and this will mark the functional ability in which a patient is now having. But after a month, we will take again the assessment of this scale to look which progress a patient has progressed, and from that we will also plan what we want to achieve in the future, or in 1 month to follow what we want to achieve. So through all of this scale is helping to plan all of this, as well as it is used to evaluate functional impairment of a patient with a disorder, either in both or in one of the extremities. Okay, now moving on how we give instruction to the patient. We just have to ask them by telling them we are interested in knowing whether you are having any difficulty at all with the activities listed below because of your lower limb problem for which you are currently seeking attention. So please provide answer for each activities, and the patient has to circle the each to which extent that the disability he is having. We'll be discussing about what it is exactly, the lower extremity functional assessment scale. As we can see here, we can see this is the scale which is having 20 questions, and also it is having scales from 0 to 4, this grade. 0 indicating the most difficulty a person is getting while performing a task, while 1 indicating a quite bit of difficulty, 2 indicating moderate difficulty, 3 indicating a little bit of difficulty, and 4 having no difficulty at all while performing a function. So we will record each activity, as we can see, for example, walking between the room, putting on the shoes or the socks. So each column, in each line, we will mark either it is 0 or 1 or 2 or 3 or 4, and a patient is supposed to circle himself or herself in that area because he knows the best what to describe the type of pain and the extent of pain in which a patient is facing. And later on, at last, we will have to add all of those. So now we will looking into how to score it, and how to score it. After adding all of this, we have to take the maximum number of a person in which a person get over 80, because 80 is the maximum number in which a person will get within this. So the higher the score, that means the lower the disability in which a person is having. So now we will look into the interpretation of these scales. Okay, the interpretation is in such a way that when a patient is getting higher number, it means that there is low disability value. And also we have to find the percentage of disability in which a person is getting by dividing the amount and number of the number in which a person get over 80 times 100 in order to get the percentage disability. And 9 is the minimum detectable changes in which a person might get. So according to the number that we get a percent of disability, we will know The
The
reference
aspect
was
or
Maggie.
disability of
Thank
person
you
is
so
having,
much for
and we will
watching,
also know the
and that's
progress in
all
which
for
the patient
today.
is having after some time, maybe after a month, and we will also plan which percentage of disability a patient should have after another 1 month. All of this can are able to be done within the within by using the lower extremity functional assessment